I think a lot of times institutions look at the clinical burnout crisis, and they think, well, this is primarily about safety, it's about pay, and it's about administrative burden. And it's partly about those things. Those are important. I think what they miss sometimes is that it's also about agency. It's also about trust in your leaders to do the right thing, to take care of you. And it's also about your sense of community. Do you have one or not? Because we know that after training, clinical work can be incredibly isolating. Right? You're on your own, making big decisions. You don't have anyone to lean on. It can be tough. And even if you're working in a clinic with other clinicians, everyone's like tunnel vision doing their own thing. It can be very isolating and lonely. So the question of how do we build a sense of connection and community among clinicians is essential to address burnout. How do we create a sense of agency so the clinicians feel they have some control over the work that they do? An institution that my wife used to work at, she's a clinician as well, she's an internist, they made a decision at one point when they had realized that patient satisfaction and even like staff satisfaction was not where it should be. They made a decision as a health system to give each person on the floor, maybe it was each nurse on the floor or each pod, the ability, the discretion to issue a voucher to a patient if they needed it. It could be like to get a cab ride home. Because how many times do we know in the inpatient setting, the disposition gets held up because somebody doesn't have a ride home, right? Like the things that we know, the public will be shocked to understand that this is really what's like, holding people up from discharge, occupying beds, et cetera, but this is reality. They realized that made such a difference, not just to the hard outcome of getting patients where they needed to be quicker, but it gave the staff a sense of agency. Like, yeah, I can actually do something to solve the problems in front of me. And I felt when I was doing our work on burnout that lack of agency, that lack of self-efficacy was an important contributor to the burnout that so many people were experiencing. But the trusted leaders is also important alongside the community and the agency. People need to know that their leaders have their best interests at heart and are fighting for them. That is essential. And I worry in a system where we're hearing of too many health systems that are getting taken over by private equity ventures, by leaders who are trying to squeeze every ounce of profit out, even when it's coming at the expense of patient outcomes and clinician outcomes. There's no better way to destroy trust. So trust has to be earned from a leadership perspective. You gotta, I think about my residency training, why did we trust our residency program leaders? Because they showed up for us again and again and again. See, trust is not built with one event alone. And I think it is not entirely intuitive because what we hear about, the stories we see, the movies we watch, the books we read, are all about some major event that happened that rebuilt, that somehow made somebody their trusted figure. That kind of trust, quickly gained, is quickly lost. But the most robust trust happens through small moments of showing up over time, right? All those times our program directors quietly slipped us a meal voucher when we were working late because they wanted to make sure we had food. When they made sure that we got into a cab because we were too sleepy to drive home. When they came by at the wards at 10 p.m. just to check on us, to bring us some juice and some snacks because they knew that we were working hard. When they came in to just say, you know what, let me just take your pager so that you can be taken care of. I fell asleep my intern year on my oncology rotation on my glasses when I got home post-call one day and broke the stem, right? So, and I was on onc going to the pre-round at 4 a.m, getting out at 10 p.m. There was no time to go get your glasses fixed. So I did I taped it up. You guys know what this is like, right? And just tried to stick it on my face, but then the tape kept coming off and kept cutting my head. There was blood on my head. And at one point during rounds, the attending was pulled me aside. He was like, what is going on? You got this broken glass, got blood on your head. What this is? You're gonna start scaring patients. What's happening? I said, do you need money to get glasses? I'm happy to loan you. I was I don't need money. I just need time. And he said, you know what? He's I'll hold your pager. Take care of yourself. It's okay. I'll hold your pager. As an intern, to have my attending say that to me, these are the small things you do over time that build trust.